paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
The aneurysm, from my point of view, is a very subtle thing. It doesn't give you any warning. I mean, I didn't feel any different before or after the operation. And I think there's the danger.
That man right there said he was on the firing line and didn't even know it. Welcome to Rex on Call Live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we're discussing vascular health, everything from peripheral artery disease to aortic aneurysms. We'll be discussing symptoms and treatments, including varicose veins. Call us now with your questions. Your questions may be answered here live on our program by our experts. The experts answering your questions are Dr. Bobby Mendez and Dr. Wayne Smith with Vascular Specialist. To call us here at Rex on Call, just dial the number on your screen. In Wake County, call 919-744-3876. Outside of Wake County, call toll-free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at Rex Healthcare, #RexOnCall. Now, an aortic aneurysm happens when there's a bulge in the body's main artery, the aorta. When it bursts, and it typically does, the results are often fatal. Meet a lucky man whose aneurysm was discovered just in time.
It's the retirement Patrick Lamb has been planning for. He and his wife moved to Apex to be closer to his daughter and grandson. Lamb and his grandson spent hours tinkering with and enjoying this 1978 MGB.
And I've always liked cars, and I tell people I've had a lot of antique cars in my life, but they were workhorses, and they're in the junkyard.
But recently, Lamb learned all of this could have ended.
I developed a pain in my left hip, and then it went to my right side as well, and legs. So I went to my arthritis doctor to see what was going on.
Scans revealed he had an abdominal aortic aneurysm.
An aneurysm, if it bursts or whatever it does, if it breaks, they told me the survival rate was 10%. You're sort of put on the firing line.
Lamb's aneurysm would need surgery. He went to Dr. Bobby Mendez, a vascular surgeon with Rex Vascular Specialist.
Aneurysms themselves are silent. Nobody really knows they're there. They grow, blood vessels expand, and as the blood vessel expands and balloons open, eventually it gets to a point where it can rupture or pop.
And if that happens, there's a 90% chance he wouldn't make it. Lamb underwent surgery to remove the aneurysm.
And we pass covered stents through the groin, through the arteries, and we basically reline the inside of the blood vessel. So basically it's kind of like laying new pipe on the inside of bad old pipe.
Lamb's surgery was a success, and he was back to his grandson and vintage car in about a day. And he knows just how lucky he is.
The fact that I had a pain in my back and got it in my legs was a blessing in disguise. Had I not had that, I could have very easily had issues with that aneurysm and not be talking to you right now.
And joining us now are Dr. Bobby Mendez, who you just met in that piece, and Dr. Wayne Smith. Now, we saw a little bit of it in that piece, but this is actually a life-size replica of an aneurysm. Can you show us?
Sure, thank you, Kim. Well, as I had mentioned before, an aneurysm is a swelling of the major blood vessel inside of the body. This is a life-size representation of it, and it's located right here on the lower part of your abdomen, just above the level of the belly button. And the aneurysm itself is just where the aorta is swollen open, and it can have a risk of rupture and or popping.
And you wouldn't feel that? You wouldn't have symptoms of that?
Right. Most of the time people don't, and we find it incidentally, which is the way that we had found the gentleman you had saw earlier on.
Yeah. Okay. Dr. Smith, tell us, I mean, there's the aortic aneurysm, but there's also, for vascular disease, peripheral artery disease, PAD.
Right.
What is that?
So PAD is a problem with the circulation going to the legs. And about 10% of people over 70 have PAD. It's typically associated with diabetes, smoking, high blood pressure, elevated cholesterol. And people who have PAD are at increased risk for abdominal aortic aneurysms.
Okay. And tell me, what, you know, Patrick Lamb, who we just featured, he had some pain in his legs. What are some other symptoms that people might not, of PAD or aortic aneurysm?
Right. As mentioned before, a lot of the times it's silent, and it's known as a silent killer. And it's found sometimes from CT scan or imaging after somebody comes to the emergency room with abdominal pain or back pain or leg pain. If the aneurysm does rupture, then that is exactly the way that it presents. Severe abdominal pain or severe back pain that makes you want to come to the emergency room.
Because we're trained, right? If you have chest pains, you go to the emergency room, but sometimes leg pains, we're just going to work through it.
Right.
Yeah, and
unfortunately, that's correct. It's a little bit of patient education. You know, we have been ingrained so much to chest pain, come into the emergency room, see your doctor, but leg pain, tough it out and make sure that we can get through that, and that's not the way it should be in today's world.
Okay, talk to us about treatments, Dr. Smith, for vascular disease.
So I think the main thing with peripheral vascular disease is what is the severity of it. So we are able to image these arteries with ultrasound. We're able to physiologically measure blood pressure at the foot and compare it to the arm. And depending on what stage of peripheral vascular disease you're in, determines whether or not we can manage you medically versus needing an intervention, either a catheter-based intervention with balloon and stenting, or even potentially a bypass to the legs. But the mainstay for most patients is medical treatment. So if you smoke, you got to quit smoking. If you got diabetes, you got to get it controlled. If you don't exercise, you got to start exercising. And regardless of your blood cholesterol, it was too high because you got the disease.
Okay.
So
if you have high cholesterol, this is something that you need to be aware of.
Right. But if you don't have high cholesterol, you still can get it, particularly if you've got a smoking history or diabetes.
Okay. And if you have, I mean, and my family, it's heart disease, and we know of that. Should I also be now more aware of vascular disease in general? Is that something that they're going to check me for, or do I have to ask for it?
You should be checked for it by your primary care physician, most definitely. And as Wayne had mentioned earlier, most of the management today, the first line should be definitely medical. But if you do have lifestyle limiting pain in your legs, most definitely there's different options that we've got for you, as he had mentioned, catheters or operations.
Now, vascular health is an indicator for a lot of other problems. What sort of other problems could be happening if you have vascular disease?
So what you're looking at is that atherosclerosis is a systemic disease, right? So it can manifest with a heart attack, it can manifest with a stroke, it can manifest with an aortic aneurysm, or it can manifest with poor circulation to your legs. So it's what we call a systemic disease. So maybe the first place you get it is in your heart, but if you find it in the legs, there's at least about a 60% chance that you've got heart disease and don't even know it.
Okay.
So screening for vascular disease in the legs often leads us to automatically go here and here.
Oh, okay.
Because it's that kind of disease.
Okay, and we're going to talk more about screening right after this. We're back after the break to answer your questions. Give us a call or send us an email. We'll be right back. This is Rex on Call. Welcome back. This is Rex on Call live on WRAL. Today we are answering your questions on vascular health, everything from treatment of peripheral artery disease to aortic aneurysms. If you have questions for our experts, call in now in Wake County 919-744-3876. Outside of Wake County, toll free 877-277-6252. If you're watching us or streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. Find us on Twitter. We are everywhere at Rex Healthcare, #RexOnCall. If you have risk factors for peripheral artery disease or an aortic aneurysm, there are very simple screening tests to diagnose these issues. So simple, in fact, that I did it myself.
There's no pain, no preparation, just a look inside at your abdomen.
So what I'm illustrating is a abdominal aorta ultrasound with color flow Doppler. And we're starting right below the tip of the breastbone. This is the proximal abdominal aorta, and you can notice a pulsation from blood going through. So this is the aorta. And then what we literally do is freeze this image, and we measure the diameter of the aorta here. And this gives us a diameter of the aorta. If that exceeds 3.0 centimeters, that's an abdominal aneurysm.
So that looked, I'm assuming, normal.
That's completely a normal exam.
High five.
Right. Okay.
This part of the exam took about 3 minutes. The screening test for peripheral artery disease, or PAD, is just as simple, and it's an important exam if you have at least 2 of these risk factors. If you're over the age of 50, if you're a smoker, diabetic, obese, have high blood pressure, high cholesterol, or have a family history of PAD, heart disease, or stroke.
If you don't adjust risk factors, there's going to be progression and further limitation of lifestyle. And depending on where the blockage is and how many segments, I mean, theoretically, you could risk limb loss.
Okay, and we also, it's important to know, you guys have a screening coming up. You want to tell us a little bit about that?
Yes, well, we are going to do a screening at our practice location.
On December 14th.
December 14th, 8:30 to 11:30.
And there's the phone number there you can call to, do they have to make an appointment, I'm assuming?
They do.
Yes, and there's a $25 fee, which is a very reduced rate. And
Yeah.
what sort of screening is going to be doing?
We're going to be screening for aneurysms. So we would like the patients to be preferably 65 or older, and to have had some smoking history, so it's
Okay.
not a waste of their time to come in.
Okay. Or have some of those other
Or
risk
some of those other
factors
risk
that we
factors,
just saw.
yes.
So they can call the office and find out more. When talking about aneurysms, and we got a couple questions on this, how do you fix them?
Well, actually, technology has been tremendous in that area. It used to be that we used to open people up, as hard as that sounds, from their sternum all the way down to their pubic bone, basically cut it out, remove it, and then sew everything back up together again. And they would go out to the intensive care unit for 2 to 3 days and then be in the hospital for about 10 days.
Wow.
And the recovery time was about 6 weeks to 8 weeks. In today's world, we use actually the covered stent. And
Yeah,
I have an
show us.
example of one here where we actually this is collapsed down to about the size of a straw.
Okay.
And it's taken into the blood vessel and then it's released. And it basically relines the inside of the vessel. And this is all done through about a 2-millimeter incision in the groins.
Okay.
And the patients recover very quickly. They go home the next morning and they're back to normal activity, as you saw with Mr. Lamb,
Yeah.
or golfing within about a week.
Okay, awesome. And we got a lot of questions on that. So this is from Addie. Is the pain and tingling and numbness in extremities a sign of hardening of the arteries?
Okay, it can be. There's a lot of different symptoms that we have to, tease out, and we do that with a physical exam in combination, and we're able to determine whether or not it is related to the arteries or the blood flow when we see you in clinic. So that is a situation where I would recommend seeing your primary doctor or coming to see us.
Okay, Darlene wants to know, she had an open heart surgery 12 years ago. Will she likely have to have another open heart surgery at a later point in her life?
Well, we're talking vascular,
Yeah.
but it's not likely that she is through with procedures.
Okay.
That's
she
the
said
simplest
that.
I
thing.
think a good way to say that is, we have not discovered a cure for atherosclerotic disease.
Okay.
We can make things better for a while, but we haven't cured it, so there is a good likelihood she'll have something.
Okay, Laura is on cholesterol meds and her legs hurt. She's on Zetia cholesterol meds. Does this med hurt her legs?
So Zetia typically does not cause leg pains like some of the statins do.
Okay. Michael from Zebulon has trouble with with one of his feet going to sleep. And apparently you, Dr. Mendez, put a stent in his left leg, and he's wondering what about his feet going to sleep and tingling on his other leg?
Going to sleep is a little bit different. Usually the pain related with arterial disease is effort pain. So when you walk, you get a pain in your calf or a pain in your thigh. If you get that, going to sleep pins and needles sensation, it's not necessarily related to the arteries, but hopefully we'll see him back in clinic to take care of it.
Okay. Diane from Fayetteville she has a pain in her legs and bones. Her doctor tells her it's tendinitis. How do you know if it's something more serious?
Well, I think that first of all, you look about do you have risk factors for vascular disease, right? Mm-hmm. So if the answer to that's no, and say the patient is under 70, it's probably not likely to be vascular. But it's so easy to screen for peripheral vascular disease that you kind of know you don't have something, and then you move to what you might have.
So her general practitioner should be able to recommend
a screening. Yes.
Okay, and that could answer that question. This is from John from Mebane. He had a chest pain, and he still has pains while walking, but he often dismisses it. If you have chest pain, let's just say you should go to the ER.
That's probably the best thing. If you're having chest pain when you walk, or chest pain even when you're at rest, that's something that you should get to see your doctor about pretty quickly.
And pain while walking.
Right, so the question is it pain while walking in his calf or in his chest? If it's in his calf, that does sound like it could be related to the arteries in his legs. If it's pain in his chest while he walks, he should see his doctor regarding his heart.
Please get that checked out right away. Okay, to call us, our experts use those numbers that are on your screen right now, or email us your questions to rexoncall@rexhealth.com. We'll be right back with more of your questions. Welcome back. We are taking more of your questions, and we've got a lot of them. So let's get to work. This says Shannon from Clayton. Her mother has a blockage in her lower extremities. What percentage of blockage is required before treatment?
I think that's a very good question, and basically we can base her interventions or procedures upon her symptoms rather than the amount of blockage. So if it does limit her lifestyle, makes it so that she can't walk to where she needs to go, can't do the daily activities she wants to accomplish, that's something that we should think about treating.
Okay. Dolores wants to know, she has a red knot or varicose vein in her leg. Should she go to the doctor?
Yes. It sounds like she's got thrombophlebitis.
Okay, and how do you treat that?
With, depending on where, something as simple as Advil to as much as anticoagulation, with full treatment.
Okay, Elaine was diagnosed with an abdominal aneurysm about 4 years ago and was told it had to reach about 5 centimeters before surgery was done, and that's different from what we heard before.
Right. Well, she is correct about that. The aneurysm rupture risk increases significantly when it gets to be about 2.5 to 3 times the size of the normal blood vessel. So it is a little bit to do with the relationship to her normal blood vessel. But the average growth of an aneurysm is about 5 millimeters a year, and the recommended or the standard of care across the country is to start treating them at about 5 centimeters in size.
Well, my question is, if it does burst and the results are fatal, why wouldn't you treat it?
Great question, and the answer to that is that below 5 centimeters in size, the risk of rupture is extremely low. And if you're talking about trying to fix it, there's always some risk inherent with the operation or procedure.
So you're weighing risks?
Weighing risk to benefit ratio, correct.
Okay, so Leona and Zebulon, she has a pain in her left leg and she says it hurts all the time. What kind of treatments are there for leg pain?
Well, I think, that pain that's continuous could be a vascular disorder if it's severe. Mm-hmm. So, we kind of think about starting with the worst. And the worst would be that she has no circulation. And then there are many causes. There's muscular pain, radicular pain from problems in the back.
Yeah.
So lots of causes for leg pain.
Yes, and actually this is Cheryl from Sampson County. She has pain in her left hip. It goes to her right side. Is there anything she should be worried about? She's 69 years old.
How old is she?
69.
69.
When you have pain in the hip that radiates to the other side, that's usually something to do with the musculoskeletal system as
Okay.
opposed to the arteries. Arteries, it's kind of like a hose. If you step on the hose, the problems are down the line. Very much the same in the arteries. When the artery gets blocked, it's the problems that happen down the line on the same side.
So if it's going this way, probably must.
Correct.
Okay. We'll have a final round of questions right after the break. This is Rex on Call. Stay with us. Welcome back to Rex on Call. We are taking a final round of your questions, and let's get right to it. This is Sandy from Nightdale. She had breast cancer and goes through if she goes through chemotherapy, can this affect vascular circulation or heart issues?
So, so patients with cancer are at increased risk for getting blood clots in the veins.
Okay.
So that's one risk. And then there's always a risk of some chemotherapy agents causing a weakening of the heart muscle, but not enough risk that she shouldn't undergo the chemotherapy.
Okay.
She should do
Just
what
be
her
aware.
cancer doctor is telling her.
Okay. Betty from Lewisburg had a CT scan on kidney and found an undilated aneurysm behind the aorta. What does this mean?
That sounds like she actually has an aneurysm, and the best thing to do is to follow up with your doctor or give us a call to follow up on that and make sure that we take care of it or continue to observe it depending on the size.
Okay, Henry has a left leg cramping and it suddenly occurs. It can last from 4 to 5 minutes up to 45 minutes. Is this a vascular issue?
Well, if it's a cramping when he's walking,
Yes.
it sounds like it can be. If it's a spontaneous cramp in the middle of the night, it likely is not related to the arteries. It may be related to electrolytes or other issues, musculoskeletal in nature.
Okay, this patient has PAD and the left calf. Doctor says for him to walk, but he doesn't want to insert and does not want to insert a stent. Should he seek a second opinion? Uh-oh.
So I don't think that's a bad question. I think, you know, one of the nice things about disease in the legs is that you can walk through the pain and it builds new blood vessels and smaller blood vessels around the blockages. So that's the right thing to do, although it's very difficult to do. And there are other options than just a stent or an operation. So I do recommend coming in and getting another evaluation or another opinion.
Okay, and there's another person with an abdominal aneurysm at 3.6. He was told it was not big enough to see a doctor. And we talk, is there a specific size before seeing a doctor? We talked about that.
Great. I like to get involved when the aneurysm gets bigger than 4 centimeters in size,
Okay.
so that we can assess the growth rate and determine the risks and benefits.
Is all pain in legs, should that all be should that all be an indicator of vascular disease, any pain in the leg?
So the short answer is probably no, but again, if you're over 50, have diabetes or smoke, yes. If you're over 70 and don't have diabetes or smoke, it should be evaluated.
Okay, last question very quickly. Pam wants to know if there's anything she could do to help with leg swelling.
Absolutely. Exercise, elevation of the legs when she's not moving, and compression therapy. If it persists, then see your doctor about determining whether or not the veins are causing troubles in your legs.
Okay, as always, consult with your physician about any health concerns. Thank you so much
Thank
for all
you.
this great information, and to our phone bank. They are still taking calls right now. Thank you so much. Now join us next month, December 16th, for our next Rex on Call. Our topic, healthy holidays, wellness and fitness through the new year. You can email us ahead of time with your questions about staying on track during the holidays. Email us at rexoncall@rexhealth.com. Consider this your preemptive strike on that holiday weight gain. We're going to give you some tips and tricks to keep it off. Thank you so much. And also that the screening on December 14th. That's very important. For $25, give their office a call. Thank you very much. We'll see you next time.
Thank you.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.